ABC News presents a coronavirus vaccine information forum. Brought to you by Muskingum Valley Health Centers.
Here at MVHC, we offer adult, dental, pediatric, women's, pharmacy, and transportation services, as well as behavioral health. We accept all patients. Make your appointment today if you're not feeling well. Here at MVHC, we offer adult, dental, pediatric, women's.
Talking about COVID-19, and this time specifically dealing with the vaccine and trying to answer some questions that have been submitted to us. I'm Dave Wilson, and I'll be moderating today. And joining me, we've got from Southeastern Med, we have Gina Woods, the Chief Nursing Officer there, and the vaccine team leader, Joe Ogle. Hopefully I got that title right. Yeah, so just let me know if it's otherwise. Jeannie Blake is here from the Muskingum Valley Health Center. She is the Chief Patient Experience Officer. From the Cambridge-Guernsey County Health Department, Health Commissioner, Dr. Ed Colby. And also from the Noble County Health Department, we have the Director of Nursing there, Registered Nurse, Sherry Rayner. So thank you, each of you, for being here today. First off, I'm going to ask a doctor question. And Dr. Colby, is the vaccine safe in your opinion?
I think absolutely. It's been studied in multiple countries, and there have been really no major adverse side effects. And it's pretty remarkable that they were able to do what they did in such a short period of time.
Joe, I want to ask you, in your position as the team leader on the vaccine team at Southeastern Med, how do you manage the extra doses or the no-shows that may be there for the clinics that you're putting on?
Sure, thanks, Dave. Yeah, so that becomes logistically something quite tough. Once you puncture that vial, you have 10 doses to give within 6 hours. And so as you start planning your day for the community, as you start to get to the end of your day, you see, was there some attrition along the way, some no-shows and cancellations? And then we have our call list there in front of us that will begin to plan as we start to see if we have 3 additional doses left over. We go to that call list and we begin to call folks.
Well, Gina, in your position, you got to be getting a lot of contact from the general public. How do people get signed up? What is what's the best method? We're looking at 4 different entities here. Which way do you go?
Yeah, that's a great question, Dave. So we all have been working very closely together. So in the beginning, Guernsey, Noble, MVHC, and Southeast Med, we've worked together because we want to do as much as we can to get shots in the arms of community members in Guernsey and Noble County. So each individual entity has a phone number or a way in which they can register, and that's publicized mostly on everyone's social media site. So we've had questions before about, should I register for more than one site? Most people do call different places, and you can put your name on the list. The one thing that we ask, and that we also ask when we schedule you and when you come to get your vaccine, is that you've called the other entities to let them know that you're not coming, because that dose is very critical. And as to Joe mentioned, in the Moderna vaccine, you have 10 doses in 6 hours to puncture, after puncture for that vial. So if we can control the number of what we call no-shows that don't show up, likely they have an appointment somewhere else, they got in quicker, that would be most helpful for us.
Sherry, how's the pacing of the vaccine inoculations gone in Noble County? Have you had problems getting everybody, I guess, in groups of 10, for lack of a better term?
We have had a few issues relative to no-shows and that same thing. So we also have a list that we refer back to call people in, because of course we don't want to waste any doses. This is precious vaccine, so that's how we follow. We have a call center. So our central scheduling call center also has a list of persons that they have not gotten back to yet. We'll call them and say, hey, who's on your list? Could you give us that number and we'll call them directly? And if they can get here within 15 minutes or so, then we'll fill that spot with that person.
Oh, that's great. Jeannie, I've got to ask you, since under the Muskingum Valley Health Center's umbrella, you have multiple locations with multiple medical professionals in each one. So one question that's been asked is, will my doctor's office be getting the vaccine at some point in the foreseeable future?
So at MVHC, we have 4 sites, one in each county, and each of those sites is registered to be a vaccine provider. So all of our physicians at that site are part of the registry. So we are getting doses in all of the 4 counties in which we're located. We have received thus far an allotment each week. It's been varying doses. It started out in Guernsey County, 200, and then the subsequent weeks have been 100 doses. And we operationalize it the same way as the other organizations do. There's a way to contact us on social media. We will vaccinate our patients as well as anyone in the community. So when we're contacted, we have a wait list that we put patients on. But in addition to that, we also reach out to our patients when we know, the age group that they're falling within. So we're receiving calls, but we're also making calls to patients to say, your age group is coming up. Can we put you on the schedule?
Dr. Colby, for practices outside of these immediate organizations, is there any possibility that individual practices or individual groups outside of what's here will be getting the vaccine as well? Or do you think supply will get to that point?
No, I don't think you're going to see any physician offices actually. Like they said earlier, you have to register to be a vaccine provider. You have to be able to meet a lot of requirements as far as how you handle the vaccine, how you store the vaccine, and unless it's a huge physician practice somewhere, I don't see that happening. I do know that I think Rite Aid is going to be getting vaccine here in Cambridge. I think I heard the other day from Rose, so it's possible that Rite Aid will start to be offering vaccines, hopefully in the very near future.
Well, that's great. Let's say that I've had COVID-19 already. Should I get the vaccine? And Gina, let me ask you that question.
Sure, that's a great question, Dave, and I'll have Dr. Colby back me up if I give misinformation. The guidance changes sometimes frequently, but the recommendation is if you have tested positive and had COVID-19, it's recommended to wait 90 days, but it's not required to wait 90 days. So we have had several people who have had COVID and 3-4 weeks out, they come in and get vaccinated. So there is a recommendation out there, but not a requirement. Dr. Colby, is there anything to add with that?
I think the whole rationale for the 90 days is that they think that, you're going to have some immunity from the infection for probably at least 90 days. So, you're right. You don't have to wait the 90 days. You can come in sooner, but most of those people are probably protected for close to 3 months.
Joe, if the antibodies that you have as a result of having COVID remain for the 90 days, what about the vaccine itself? How long is the effectiveness of that expected to be?
Dave, that's a $1 million question, to be real honest, and I may have to defer to Dr. Colby. I don't know that that's known right now. I think the CDC continues to look at information. They want it to be a lifetime, but certainly I don't know. I would have to defer to Dr. Colby on that.
Yeah, no, I agree with you. I mean, it's a big unknown. There's a study going on now where people who are getting the Pfizer or Moderna, and they're going to say, let's give them a second vaccine with the Johnson & Johnson product, which is a completely different vaccine, and see if the immunity is better. I mean, it's a moving target. These studies are ongoing, and time will tell. I got a feeling we'll be checking antibody levels in people to see if they have continued protection. This could be a seasonal thing. We don't know. It's a big mystery.
That makes sense. It is still in the early stages. There's no doubt, I guess, comparatively speaking. Shirley, let me ask you, from your experience on the vaccines that have been given so far in Noble County, what can people expect after getting the shot? I'd say maybe after the first shot and the second shot.
Yeah, so far, we've had great responses. Vaccine side effects have been minimal, especially with the first dose. Most commonly, sore at the injection site, so a little sore arm, basically maybe some upset stomach, fatigue, a little bit of a mild headache for less than 24 hours. And that's mainly with the first dose. With the second dose, we do see people respond a little stronger. Some respond a little stronger to that. Maybe mimic a little bit of COVID symptoms like chills, a low-grade fever, and a little Tylenol or ibuprofen will take care of that if needed. But really, we've had great responses so far. No anaphylactic reactions, thank goodness, which is the severe allergic reaction. So people are responding very well to it.
Thank you. Dr. Colby, mentioning that so far as an allergic reaction, what if people will say, I've got medication allergies that I deal with, antibiotics or whatever the case may be. How concerned should people be with that factor?
I don't think that's a big concern as far as antibiotic allergies, that type of thing. That's not a big concern. There's a precautionary thing for people who have anaphylactic reactions, say to bee stings or something. It's not an absolute reason not to get the vaccine. The benefits of the vaccine far outweigh the risk of having a potential reaction, but that's why the sites, again, have to be equipped with, epinephrine and Benadryl and things like that to treat a reaction should it occur.
Joe, as you're running the clinics and all, I would assume there is when I get my basic allergy shots, I have to stick around for 15 minutes. So I'm sure there's got to be some kind of an observation period that's after that.
Yeah, Dave, that's absolutely. The Moderna fact sheet, in fact, recommends and requires a 15-minute wait period after it. Obviously, it's a new vaccine. We're not certain. I know Moderna says that, and actually read it here, it says you should not get Moderna if you've had a severe allergic reaction after a previous dose of the vaccine or severe allergic reaction to any ingredient in the vaccine. And if you've read the ingredients, they're hard to pronounce even. So the 15-minute wait period is just a way. I think, it's comforting too to know that there's a healthcare professional there waiting. I know, the team here and Dave, I lead the team and it's an absolute great team, but we have a pharmacist that's here every vaccine clinic and is able to answer any questions. We, in fact, as Dr. Colby stated, we have epinephrine, Benadryl, we have a box of stuff that we can utilize. And certainly we're right here at the hospital. So if anything happens, right here, and people are comforted by that. We've even had some people wait 30 minutes. They said, I know I only need to wait 15. I'll go ahead and wait 30 minutes. No problem. No problem at all. So really, because of the novel vaccine, that's kind of for that 15-minute wait time. And I do think it's reassuring.
Yeah, that makes sense. And, too much caution is a pretty low risk situation. So yeah, you might as well err on that side of it. Gina, I hear Joe mentioning that you got your pharmacist involved, and it sounds like it's quite the mobilization. Is that part of why the Southeastern Med has just been doing one clinic a week?
That's a great question, Dave. So part of that, the main reason with one clinic a week is just the short supply of vaccine. So we're not guaranteed vaccine each week. And so we really have tried to ensure with the size of the room that we have, maintaining social distancing, with the wait times and thinking about getting, 10 folks in there at a time and the mathematical equation that they all comment on, we determined that one day a week right now, we give about 220 vaccines for a day. We've been doing those on Saturdays. We will be moving in the future after second dose are done with folks to during the week. But we would love to do it 7 days a week if we had vaccine, and we would do it. We'd make that work, wouldn't we, Joe? I think everybody on the call would do that. But it is the limited supply of vaccine right now that limits how often we can do this.
I guess you would say you put that in that would be a good problem to have category. So
it would be an excellent problem to have.
Yeah.
And I really hope you have that problem. Just my personal opinion. Jeannie, in the situation of Muskingum Valley Health Centers, you have multiple locations in multiple counties. For the patients, like you may have a Coshocton County patient going to Zanesville or a Muskingum County patient coming into Cambridge. When you're trying to navigate the folks into a shot clinic, do you do it by residents? Do you do it by who their healthcare professional is? How do you handle that?
Typically, the patients, for example, in Guernsey County, usually live proximal and in the county. But let's say that they don't. If they're seeing a Guernsey County, one of our providers, but they live in Zanesville, we really don't take that into consideration. We base it on who the patient's provider is and where that provider is located. Does that make sense?
Yes. Sure.
So in the case of, we've mentioned extra doses. We typically, if we have extra doses on our day at our Cambridge site, then we focus on those patients in that area. So we don't have to be county specific, but it usually ends up being in that manner because people usually live proximately to the county in which we're located.
Sherry, let me ask you on your planning as you put your clinics together. How do you stagger things to make sure that you've got that second dose? How difficult is that? Do you feel confident the supply will be there, or how do you handle that?
Yeah, as of now, the Ohio Department of Health, ODH, has assured us that they will be, for every first dose, that's where our vaccine is coming from. So they have assured us that with every first dose we give, there will be a vaccine for that second dose. And that has held true to this point. At the more scarce vaccine gets, there may be some changes in that. But as of right now, for every shipment we get, they have promised us that there will be a second dose for that, because we have both Moderna and Pfizer vaccine. So that does make things a little bit more tricky, and more planning needs to happen, because of course, if they get Moderna with the first dose, they must have Moderna for the second, and same with Pfizer. So we can't intermix. And so far, we're early into this, but so far ODH has held that end of the bargain with getting us those doses.
Gina, are you seeing pretty much the same thing at Southeastern Med?
Correct. There's a lot that goes on behind the scenes. After you register to be a vaccine provider, there's actually a website that will tell us how many vaccines we're getting. We typically don't know that until a day or two ahead of time sometimes. But every time we do a vaccination clinic, we register and put those folks into that website. So the state knows how many we're giving and when we're giving them to be able to replenish that. So we have seen that consistency with that vaccine coming back in for second doses. And we are just going by faith week to week that's going to continue.
Well, let's hope it does stay that way. That sounds promising nonetheless. I know there probably wasn't any math expected for this, but I'm going to ask each of you, or at least for the respective organizations, one question was, how many vaccines have you given so far? So Joe, being the logistics guy, how have you done at Southeastern Med? How many?
Great question, Dave. As far as our employees go, we have vaccinated, and I'm going to give you employee as well as community. Employees, we've vaccinated 385 folks. As far as our community vaccines, we've done 703 to date. We have 200 scheduled again for this Saturday, so 703.
Dr. Colby, with the Cambridge Quincy County Health Department, do you have a count there?
Yeah, I do actually. As of the end of the 9th of this month, we gave 1,713 vaccines. Now, keep in mind that includes 1A initial vaccines, 1A second vaccines, as well as 1B initial vaccines. And currently we're doing 6 days a week running clinics. So, and I want to echo what the other members said, that so far we've been getting enough vaccine to continue and, you know, push forward and give the second dose. So far, so good.
That's great. Jeannie, what about MVHC?
In Guernsey County, we've administered for residents almost 600 doses. And then, so that's just in Guernsey County. For 4 counties, you can almost double that. And employees, of course, we have employees in all 4 counties. We vaccinated 154 employees. And the amount we get does vary a little bit from county to county. Guernsey County has the first 2 weeks got 200, and now we're down to 100 doses. But we've almost hit 600, and we'll expect to do, we get another 100 dose allotment next week as well. Now, one thing that we've heard, once the schools are done being vaccinated, we might experience an increase in number of doses, which I think probably we all expect that. So that will hopefully be true, because again, you know, our wait lists are extremely long.
Sherry, in Noble County, what kind of numbers do you have down there?
Yeah, so far we have given 1,464 doses, and 394 of those have been second doses.
Oh, so wow, you're that deeply into the second dose then.
Yes.
Gotcha. The you know, you look at those numbers and it's just amazing. But one question that we do get for people under 65, an educated guess as to when the vaccine may be available there. And Joe, okay, you're the one leaning back in your chair. I'm going to ask you, are you deferring, sir?
Another $1 million question, right, Joe?
Yeah,
absolutely, Sherry. Dave, wish I could answer that. Dr. Colby, maybe I'll defer to him.
I'm just going to ask everybody to pick a month, and we'll see who's closest. I mean, I think you're probably looking at late spring, if I had to guess.
Gotcha. Yeah, that I guess it makes sense, because you've really demographically you're covering a lot of ground already. So I can only imagine how that can work out.
And Dave, I will say that I think statistically, if I looked at the Ohio website this morning, I think Guernsey County, over 50%, 55% of those 80 years plus we've vaccinated thus far. And those are the most critical ones that we really needed to get to. So, and I know everybody wants it, you know, that are younger than that 65, but that's why Governor DeWine made the decisions that he made. So I think we're making a big impact on those folks' lives, and we want it to roll out there, but we've got a waiting list that's, I will tell you, probably over 1,000 people right now. And we don't see any end in sight just for those waiting lists for the 65 and older. So.
Well, Joe, you mentioned that 50% of the 80 and over, that other 50%, do you have any feedback that is it they're afraid of the vaccine, or they just haven't made the effort to get it yet? Or do you have any feel for that at all?
You know, that's a good question too, Dave. I know, you know, I think the country is divided a little bit. You know, I think it's 50-50, those folks that feel they want the vaccine and those folks that feel that they don't. So in fact, this could be very well statistical that 50% opt in and 50% don't. I will tell you, a lot of the 80-year-olds that we've worked with have waited for this day, and they literally have said, I haven't been out of my house for 6 months, 9 months. And I believe every word of it. So they're ready to get out. And if it takes this vaccine, they're going to be there. So, but again, statistically, David, that may be just par for the course.
That would make sense, I guess, to an extent. Just the peace of mind factor. It seems like it would just be golden. But here again, when you take a look at specific groups that you hear aren't responding, and Gina, I'm going to ask you about this because you have RN at the end of your name, and I believe a Bachelor of Science in Nursing. You are a consummate professional. Why do you feel there are so many people in healthcare? I'm thinking specifically geriatric care, in assisted living and nursing facilities, that are opting not to, when you hear of those being like the petri dish, the hotbed of the COVID virus through this whole process?
Sure, that's a great question. So I think there are, whether it's rumor or not, and Dr. Colby could let me know if there's any fact behind this, but there is a lot of rumors out there, myths out there, but one in particular that we hear is that in women of childbearing years, that there can be concerns with fertility. And so when I have talked to folks who are in that category, that has been the reason that they have given me that they did not want to take it. And I see a lot of that chatter on social media. Otherwise, I think it also goes along with, there are people who really have taken this virus very seriously, and there's others who haven't. And so again, I think those who take it very seriously are like, yeah, get me the vaccine. I was ready when it was my turn. But then there are those who are like, well, if I get it, I get it, and I'm not really worried about it, and they don't take it as seriously. And I think we see that division in who chooses to be vaccinated and who does not.
I guess that would make sense. Anybody have anything to add to that?
Yeah, I would agree. I even know some medical professionals, physicians, nurses, not necessarily locally, but who have said they're not going to get the vaccine. So, some people you're never going to persuade.
That's pretty much life itself. Jeannie?
You kind of mentioned the 50%. That's the percentage that we see in our own employees. So again, healthcare professionals, and for a lot of the reasons that Gina mentioned, are just fear of a new vaccine. So 50% of our staff elected to receive the vaccine. But I think we talk with other colleagues in other organizations, they're seeing the same thing.
Sherry, I got to ask you, I see you nodding your head. Are you seeing pretty much the same percentages in Noble County?
We are across the board. Now, our own staff here, we had almost 100% uptake, but across the medical community, which we're very small, about 50%. And then that was consistent with our schools as well. Well, we did vaccinate our schools last Friday. And we have 2 school districts, both of them, it was about 50% with each school district uptaking the vaccine. And one thing I share often, which was from our medical director, Dr. Richard Clark, when he talked to us about the safety of the vaccine, and of course he referenced some medical journals and some different things there, but also, his last comment, and it was very simple, but it's so true. People are dying from having COVID. They're not dying from getting this vaccine. And that was pretty profound. And, I've been able to share that then with some people that were on the fence, and they thought about it for a little bit and changed their mind. So, it's just about education and that fear factor. I agree with everything everyone else has chimed in and said on it. It's that fear because it's new.
Dave,
I'm sorry. Go ahead, Joe.
Sorry, Dave. If I could add, I know, I've had some folks, employees, non-employees, just people I know that would say, other than not getting COVID, which, if I'm 30 years old, the odds of me suffering this to being a fatality is pretty low. What am I getting out of this? What I would like to say is that I think yesterday the CDC said that 14 days after you've received your second dose, either of Pfizer or Moderna, if you are exposed to someone that was positive for COVID, that there's not a quarantine process. Just read it last night, so we'll have to go through the CDC again. But again, now this is an incentive, I think, to get that vaccine. And that maybe that incentive wasn't there before because, I'm 20 years old or I'm 35 years old and I'm a nurse, or not even nurses, but whomever was eligible. Now there's some benefit to it. And I know I've had other people say, well, if you let me take this mask off, I get the vaccine. Well, that's not coming there yet. We're still going to have to social distance and use the mask. But I think some of it was that they lacked motivation for it or an incentive.
I think you may have answered also in the process 2 more questions that I had. Number one, the mask stays on indefinitely. We are still some distance away from that point. So I'm sure that's got to be a point of emphasis. And another question was, how effective is it and when does it kick in? So are we saying that you start seeing the benefits from it as soon as 14 days afterwards, or did I understand that correctly, Joe?
And I'll let Dr. Colby, 14 days afterwards, Moderna says you're 94.1% protected from COVID. I'm not sure. I think Pfizer's right at 95%, but I think it's that 14 days after that dosage, they indicate that effectiveness.
The second dose.
Second dose. Yes, second dose.
Okay,
Yeah,
so all of that is based on second dose.
Yes.
Yeah, but there are some studies that show after your first dose, within a couple of weeks, that you do develop some immunity. I mean, it's somewhere around the 30 to 50% range, maybe. So, it does afford you some protection until you get your second dose, which I agree, after 2 weeks, you should be about 95% protected.
No, that's a pretty healthy number. I've got just one more question I've got, and then I'll let you individually consider to see if there's anything else that you want to add. And Jeannie, I think this would probably best go to you. And since you cover so many counties, how from the state level, from that point of distribution, do you know how they determine how many doses go to each individual county?
They do look at the population in the county and the different age groups. So we're told that they base it upon that. And I don't know, I'll let the others chime in. I'm not sure. And again, we're receiving very low numbers of doses. So for example, in Guernsey County, it was 200, 200, 100, 100. But when you look at all 4 counties, it's basically the same number of doses that we're receiving. And in Coshocton County, the first week we got 300 doses and the other counties were lower. So we are assured that there is a calculation based on the population in that county and the age groups. But again, I think there's just such a limited number of doses that it really cannot be an exact calculation.
Okay, does everyone pretty much concur in your particular areas of influence?
Yeah, I would agree. We actually have, there's a Southeastern Ohio representative that works with the Lieutenant Governor's office that we can contact. They usually contact us twice a week. And then we can call them if we have concerns about vaccine. And, and even they can't promise us any certain number of vaccine, because it's still, I agree. It's some weeks you get 300, some weeks you get 100.
Yeah. And
for people that really, I'm sorry, go ahead.
There doesn't seem to be any logic behind that, because we saw one county go from 300 to 100 and then back up. So it's a guessing game a little bit.
For each of you, for people that still have not called in, that are within the affected age groups, I would assume the contact information would be found on your respective websites, so far as what number to call or how to contact. So we'll watch for that, and and I'm sure people can Google and find your websites rather easily.
Yeah.
In the meantime, is there anything that any of you have to say to kind of wrap things up? Anything do you think hasn't been adequately covered here? And Dr. Colby, I'll start with you because you got a plane to catch.
Yeah, I do. No, I would just like to let people know, the health department currently, like I said, we're vaccinating 6 days a week, and we will continue and do that. I agree. We would probably do 7 days a week if we had vaccine, but unfortunately we don't. I encourage people to call. We will, like Joel said, the list can be long, but we'll eventually get to everybody if they don't get their vaccine somewhere else. And, it's just important to continue to wear your mask, social distance, wash your hands, all those things, we still have to do even post-vaccine. So, and I just want to thank everybody else in the community that's doing their part, and MVHC as well as Southeastern Med. They've been great partners.
Yeah, it's great to have that kind of organizational cooperation here in our counties. That's a beautiful thing. Anyone else have anything you'd like to add that before we wrap things up?
I'll echo Dr. Colby. Our main goal and objective in the realm of vaccine is just to get it to people. And we ask for your patience. We have had an overwhelming response, which is great. But we do have a wait list, and we are, in some senses, everyone is figuring things out a little bit as they go, although I think we've gotten pretty good so far at clinics now. But we just ask for your patience. If you are concerned that you've left a message and you haven't gotten a response, feel free to give us a call back. But we are working through that list as quickly and as effectively as we can, because we are, no one is more excited and happy to get vaccine in arms than all of us providers on this call today. And we are giving it as quickly as we can get it and ensuring that we don't waste one drop.
Very good.
Yeah.
Sherry, it looked like you had something, you were on the verge of saying something there.
Yes, I would mimic both of Dr. Colby and Gina as well. But also, I just wanted to throw out, we have a central scheduling call number, and I would like to just throw that out there. It's 866-395-1588. And also, we have added a Google Doc to register online, and that is available through our Facebook site and the health department website. And it does seem to be working a little faster if people can't get through on the call center. And we've had some bugs that we've worked out of it with the call center. We just, again, like Gina, ask people for patience and to keep trying. We are getting people scheduled through there, and it is working, not 100%, but we are trying to improve it all the time. So please keep trying to call and we'll get you in.
And we'll throw that number out there again. It's 866-395-1588.
Correct.
Okay, very good. And I know at the hospital, you have the 740-435-COVID. So hats off to you for getting the personalized number on there. That's a nice touch. And Dr. Colby, phone number for the health department.
Yeah, 439-3577.
Okay, there you go. And Jeannie, anything to add on your end?
Yeah, I'd like to mention we're excited this week. We will be vaccinating all the Guernsey County school employees. So that equates to almost 900 doses that we will be administering on Friday. We've partnered with the schools, and so that's just, it's been a great opportunity. The way in which schools work is they have to have a healthcare partner where their vaccines are distributed to, and then that partner that they've identified goes on site, will be going to the school and administering those for the schools.
Super. I'm glad you mentioned the schools too. Our daughter's a teacher at Groveport Madison, and she was downright giddy after she was able to get her vaccine. Yeah, she was never that excited about shots when she was a kid. I don't understand. Funny how that goes. Joe, anything on your end?
Yeah, I would just like to say, Gina said, extend, be patient with us. But I will say this, this has been a very difficult task, but the reward that you get when that person comes in, it's worth every hour that we put into this. It really is. And being able to serve your community and the health department allowing us to do this, to be able to, at first we were very trepid. We didn't know how we were going to do it, and we developed a plan. And when you're there on that Saturday, I mean, it's pretty fulfilling. So, with the appreciation, we've gotten bags of candies from people that said thanks to the vaccine team. So it really is emotionally rewarding for us.
I'll tell you, it's been I'm sorry.
I
It's
have to
been very
echo
rewarding
that.
having
We've
you.
gotten cards and letters, and it's such a amazing thing to be a part of. Your heart just swells, and that's just what healthcare is all about. As challenging as it is, the rewards are 100-fold.
Well, we really appreciate you being on with us here today. I want to thank each of you. Dr. Ed Colby, the main guy, Commissioner of Health here in Cambridge and Guernsey County. Thank you very much. And Gina Woods and Joe Ogle from Southeastern Med, Jeannie Blake from MVHC. And if you haven't seen it yet, I'll tell you, drive out North Clark Street and check out what they just built out there. It's such a beautiful facility, and we're so grateful for that. And Sherry Rayner, thank you for being on with us as well from the Noble County Health Department. And folks, if you tuned in late or for some reason you missed some information, you can see the replays by going to yourradioplace.com or going to AVC's YouTube channel, and which is YRP-TV, and you can just watch this just as often as you'd like. So anyhow, to each of you, God bless you for what you're all doing. Thanks a lot for being here.
Thank you.
Have a great day.
Bye.
Thank you.
ABC News presents a coronavirus vaccine information forum. Brought to you by Muskingum Valley Health Centers.